and sexual problems. Dr. Nadia blew my mind when we went from A to
Вот
Z.
когда мозг не дренируется лимфатической системой, растет гипертензия, черепная гипертензия, и у него не развивается гормональная система, которая обеспечит менеджмент других желез.
And this is pretty radical in my opinion. Is it normal for a child to be overweight? That's interesting.
Lifting weight, lifting weight, lifting weight.
But that's what people usually do.
It's very popular station when
I know. That's a great result. I'm kind of impressed and shocked, and I feel really happy for this person all at the same time. Hearing the thread from conversation to conversation that you take a holistic approach to your patients.
Yeah.
So you spend a lot of time gathering information to understand what's going on. That's probably one of the reasons why I'm here and I'm doing these with Dr. Nadia, because her work is a pioneering work and it's an important work in understanding our body and in being healthy. How does a person know? Is it their lifestyle issues that are causing them to not be able to lose weight, or is it something with their health?
Oh, very true. A lot of depends of lifestyle, sports and diet. But if a person is sincere in his efforts, I mean he or she manages input the consumption of calories real good and consistently for 6 months in a row. A patient works out. A patient eats well, sleeps well, and tolerates stress well, but he or she still gains weight or cannot maintain it. It is the right time to consider medical reasons existing behind his overweight problems. And there are actually a lot of people who do not have that obvious medical problems and still cannot lose weight despite loads of efforts. You see, we work with many diseases, starting from headaches to plaques in the arteries, from myositis to cancer. By the way, cancer treatment is actually what we are known for here in PM and Russia. But for me, who is both an oncologist and general practitioner, cancer is actually much easier to diagnose than the reasons behind obesity. It is because the list of the reasons is very broad and it requires much more clinical experience and first of all time to gather medical history, starting from even the current period, then analysis all of it and come to a holistic picture of what's going on. And it's a lot of details for conclusion.
Yeah. Yeah. You know, I'm hearing the thread from conversation to conversation that you take a holistic approach to your patients.
Yeah.
So you spend a lot of time gathering information to understand what's going on. So that's how you determine what's really medical and what might be lifestyle. So for example, you know, probably many people have just lifestyle issues when it comes to their weight.
I understand.
Especially in the West, right? It's either the fast food or it's the level of stress in their lives. It's not maybe eating properly. Maybe it's not enough movement. And so that we see that all around the world right now, that's a problem for people. But you're saying that you feel that from a medical point of view, it's better to take time up front to actually really find out the reason that a person is obese or overweight.
Oh, well, first of all, a patient needs to be aware of golden weight management rules, but we assume everyone knows them, right? And secondary, we need to look at the most obvious and symptomatic medical reasons. This can be headaches, asthenia, chronic tiredness, and elevated blood pressure, problems with joints, extra plain pain. Mm-hmm. Sadly, it can be something on a deeper level. For example, issues with different glands we have, starting from pituitary gland and thyroid gland and pancreatic gland, or adrenal or microelements insufficiency. Last but not least, there is always a genetic dimension to investigate. It helps to understand the why is most organic and systematic pathogenesis.
Pathologies.
Pathologies, I'm sorry, pathologies.
That's okay. No worry on the language, right? No worry. So viewers, again, English is Dr. Nadia's second language. She speaks all day in Russian for the most part, and I'm just grateful that she's willing to come and speak in English to us so that we can have these conversations. So I love the fact that we can go back and forth in Russian and in English. It makes me feel like I know something a little bit, and let's just me enjoy. So Dr. Nadia, can you tell me what the golden rule of weight management is? You said the golden weight management rule. So can you tell me what that means?
The golden weight management rules are very simple. For first stage, if the person want to lose the weight, there are good lifestyle, there are sports and diet, good diet. But if there are not enough, he or she must go to doctor.
So we have the golden weight management rules, and then we have the pathologies that happen in the body. And both of those have to be looked at in order to understand why a person is overweight. So if a person has spent a good 6 months watching their diet, making sure they're getting physical exercise, right, and making sure they sleep and they manage their stress well, and they don't lose weight, what is next?
The next stage, the next step is to have advice of a very clever doctor.
And so you usually start with what? How do you start to find out what's going on with a patient?
Well, we usually start with a simple questionnaire, allowing a patient to analyze himself and tell us the necessary information. The questionnaire is online, by the way. After that, we know where to look for the problem. Anyway, even if you go bulk, it is no longer than a week usually. So all you need is a doctor with clinical analytical thinking and a person who is able to talk.
Okay. And I'm assuming that you start with the lymphatic system. You look at the person's issues through the lens of the lymphatic system, because the lymphatic system is everywhere in the body, in the blood, and is like you said, it's responsible for all of the well-beings of the cells and organs, right? So
yeah,
how do you investigate what's going on in the lymphatic system? What do you do?
According to our statistics, every man who is plus 30 years of age has problems with lymphatic system. What kind of problems? Extra burden on paracellular space and lymphatic nodes.
Okay, wait a second. So you're saying that every person has something going on in their lymphatic system.
Yeah.
And that it's the stress between the cells?
Yes, it is. The first problem is stress for cells, because a lot of waste are in the intracellular spaces when the person is about 30 or plus 30 age. Every person has the problems.
So the waste stays between the cells and the lymphatic system isn't detoxifying the body, and that starts to cause problems in the body.
As usual, lymphatic system is very tired in this age, very tired, because every day, 24 hours, 365 days per year, it is cleaning waste and stop waste, because it is the main problem for lymphatic system. It doesn't it can't do their functions.
And that comes from the food that we eat, it comes from stress, it comes from infection, right? Those are the reasons why the lymphatic system gets tired, right?
Yes, right. There are a lot of factors, and bad food, bad ecology, bad infection, and many different dopings, which use modern person as usually.
Bad ecology, food, medicine that we take for infections, all can, you call that dopings, okay? Right. So medicine, I love that. See viewers, there's a difference in the language, right? So medicine that we take for infection, right? And maybe even people who dope, people who do drugs, who knows? But all of these contribute to the lymphatic system and its ability to keep us healthy or to kind of shut down because it's tired. So, okay, so you're on this journey with a man and he's got this huge leg and his lymphatic system's not working, and we're talking about the golden rules of weight management and how that attaches to the lymphatic system and contributes to the functioning of the nodes. And so, okay, where does that take us? So the person comes to you, you do your questionnaire, and you see that something needs to happen on a medical sense, right? So what happens? What do you use to start to really look and see what's going on in a person?
Oh, well, so in terms of lymphatic system, we do study the condition of lymphatic nodes and the profile of immune, of course.
Okay.
By the way, it's proven that in case of excessive weight, it affects the lymphatic system. So we are having a kind of loop that we need to break medically, just medically. So we use modern diagnostic tools like MRI, for example, CT, for example, ultrasound, lab test, to understand how well the metabolic chain works. Metabolic chain works.
And what's the metabolic chain?
Basically the weight issue is about metabolism. It is a chain of biochemical reactions that determine how food turns into different substances and how they are used along with substances produced in our body. So we list the listed of glands, different glands and organs participate in these metabolic processes. If some of them are damaged or inflamed, they can work improper, thus affecting this chain. Some of them can suffer from autoimmune diseases, for example. Some glands produce, maybe you have a question.
No, I'm just listening. I'm thinking. Go ahead.
Okay. Glands produce hormones that are a very important part of our metabolic chain as well. This is why women entering menopause, for example, may develop weight issues. It's very popular situation when
I know, and I'm sure many women know, and they don't do that.
Yeah, it's very popular station for women, just for women, not just for women, for men too, Yeah, not just for women, for men too.
Yeah, I mean, you see that as men age and their lifestyle. When you say lifestyle choices, but between the stress and the work and maybe bad choices in food because of stress, work, and sleep, you could just see in the human body how the weight comes on over time. And so you're saying that the lymphatic system is also connected to our hormones, right?
Yeah, with our metabolic chain, and metabolic chain is consists of hormones, and lymphatic system manage this our metabolism very good.
That's interesting. So, okay. So what happens if, so then the lymphatic system also manages the weight of little children too, right? So some little children are heavier than other little children. And if their diets are the same, that's an interesting question, Dr. Nadia. Let's take two children that eat the same foods, but one child is thin and the other child is heavy. Could that be related to metabolism and hormones and the lymphatic system too?
The problem is the difference between birth, first of all birth, and another child could get a brain trauma during the birth. It's very popular situation, and from childhood.
So you're saying that lots of things happen during birth, a lot of common things happen during birth.
Yeah.
And each human body is a different system. So everybody's immunity is different, right? And because their immunity is different, their lymphatic system has different work to do to take care of that.
Но все начинается с родовой травмой. И вот тогда мозг не дренируется лимфатической системой, растет гипертензия, черепная гипертензия, и у него не развивается гормональная система, которая обеспечивает менеджмент других желез.
Okay. So what Dr. Nadia is saying right now is that the human body is a mysterious piece of machinery.
Yes.
And everything is connected. There's nothing in our lives that's disconnected. And what she's saying is because lots of different things happen at birth, many things can happen in the brain that we're not aware of. And when the brain has been affected, then all of your systems have been affected, and the lymphatic system is affected. And if the lymphatic system is affected, then your hormones and your drainage is affected. And so that's why we see such the variety of sickness and health in humanity. And so that's probably one of the reasons why I'm here and I'm doing these with Dr. Nadia, because her work is a pioneering work and it's an important work in understanding our body and in being healthy. And so I'm just interested about the difference. I have grandchildren, and I have one grandchild who's kind of thin and the other granddaughter who's kind of chubby. And when I look at my granddaughter, I'm like, that was me. That was me. And I've been like that forever. So here again, viewers, this is just my quest to understand what's going on. And I think sometimes we don't take care of the bodies that we've been given. And I love Dr. Nadia's approach because she takes her time and she listens and she investigates all of the different pieces of what's going on in a human being's life. And for most of us, we can stop at the golden weight management rules because we haven't followed some of those rules. But for other people who have sickness and disease and can't accomplish that, here is where her work comes in. And so the question begs to be asked, is it normal for a child to be overweight? Is that a normal part? Okay.
I can explain. It is not normal. Overweight is not normal in different age. no normal overweight. It is not normal. And yes, people are very different, and people have different immune system, lymphatic system. Children have different immune system, lymphatic system, different speed of development of organs and systems, including hormones. But overweight is not normal for children. No, it's not normal for children. And parents need to know the reasons of overweight, because when the child is growing and the problems will be growing too with overweight.
Yeah. Well, it's just like there's the Russian saying that says little people, little problems. Big people, big problems.
Yes,
right?
Little people, little problems. Big people, big problems.
So what happens if the parents don't pay attention to a child's being overweight? My parents didn't pay attention to that. What does that mean?
Let's use an example. You may have seen it on our Facebook page. A patient was 346 pounds, and one of the main reasons was his pituitary gland. He had been struggling with the weight issues for all his life, despite all his efforts, which were very impressive. He didn't produce enough hormones, which were needed to activate other hormones. This damage was caused by an infection, popular infection, he got when he was a child. He of course got his tonsil removed, like you. So,
all right. Continue.
It was in his childhood. So we prescribed some treatment, and now after 6 months he lost more than 100 pounds. It's a good result, I think.
Hell yeah, that's a great result.
Yes.
100 pounds, that's a lot of weight.
Yes. And he of course had extensive food and exercise recommendations and some medicine prescribed. But our aim is to be the shoulder or trampoline when it's needed. So the longer the person is going to be on the right track, the less medical help will be needed in this respect.
So you're the shoulder to lean on.
Yeah.
Right? Or the trampoline, the springboard to jump off of. So you help give people the momentum to actually start the changes that need to happen so they become more physically healthy.
Yeah.
100 pounds is a phenomenal result.
I agree.
Okay. That's a great result. I'm kind of impressed and shocked, and I feel really happy for this person all at the same time. That's super
He's
good.
very happy. I'm sure.
Happy. Yeah. So one small piece in the brain was the reason for this?
One of the main reasons, yes. And all because lymphatic drainage in the brain was decompensated. His lymphatic drainage was decompensated.
What does decompensated mean? Что значит decompensated?
Да. It means the lymph doesn't go from the brain into his nose, from the brain into his lymph nodes, some mandibular lymph nodes. It is decompensation. It is, it is decompensation. Я забываю туда смотреть. Я все время смотрю на Дэниел.
Okay. So then that prevents the actual metabolic chain reaction from working. It prevents the hormones from working. Then the lymphatic system doesn't do the drainage that's needed for the body. And so it goes kind of undetected, right? I mean, he was mentally healthy as a person. but it changed the biochemicals in his body.
Yes, yes. Not so with the cause mental problems, but big enough to influence it on the biochemical level. It was very main reason.
So can you forecast how fast he's going to lose the weight?
We can only make assumptions that the bigger is the weight, the faster it should go away. We are talking about abnormal weight accumulation.
So, so in this person's instance, it was abnormal weight accumulation,
yes.
right? So it was because of the lack of functioning that was going on. That makes sense. But what happens when it's not an abnormal weight accumulation?
Well, there is one more thing. Suppose a person was not very active physically and gained some extra weight. Suppose she gained 20 or 30 pounds. She now wants to lose. She is maybe in her 40s, 50s, so yeah.
That's me.
Yeah, like you. Mm-hmm. So the first thing to avoid is rushing to the gym and starting lifting weight with a fitness instructor, for example.
But that's what people usually do.
It is, unfortunately. And after that, we have worn joints, lots of stress, ulcers in the stomach, especially after salad diets and protein shakes. Yes.
That's what everybody does.
It's very popular problems. And this is not all. What is more, ladies are very tender and weaker vessels. The Bible teaches us about it. So these radical shifts may trigger hormonal fluctuation that can be real dangerous cancer-wise.
So you're saying that the female body is a more intricately and delicately put together body, and the approach has to be different than what most people take.
Yes.
And because we need to take a different approach, well, let's put it this way: if we don't take a different approach, then we trigger like hormone fluctuations that produce other things. Okay. So what's the better thing to do, Dr. Nadia?
The better tactics is to ask your doctors about advice for you. Do at least a questionnaire. Know your risks and start with regular walks in open air. Is a good way for starting. It's a good tactic.
So you're suggesting going outside
yes,
with yourself or a friend and taking good long regular walks to start with.
Because
that's a good. Go ahead. I'm sorry, I didn't mean to interrupt you.
It's very safety way for every lady. Walk.
Safe way.
It is very safe way for every lady.
Okay.
To lose weight.
So walking is a safe and gentle way to lose weight for women when they start. Okay. So is it ever okay to go to the gym and lift weights? Is weightlifting okay for a woman to do, in your opinion?
If lady, for example, hasn't physical culture in childhood, when she was a teenager, and later, it's very dangerous for health. A lot of activity for joints, for muscle, for heart, for lungs. It's very dangerous because we have a lot of problems with such ladies. For example, some months ago we had a lady in our clinic, and when he was a child, he didn't like the physical culture, and now she is 50s, and she decided to has a lot of activities. His joints were very damaged, very damaged.
Mm-hmm. I think we'll talk about this again.
Mm-hmm.
I think I'm pretty curious about the approach to exercise in connection with the lymphatic system for a woman. And I'm really interested that you've kind of separated the male body from the female body in terms of medicine and taking care of it. So I was not expecting this part of our conversation, and I want to make a check mark so that we come back to it and we talk about it again. If you're okay with that, is that all right with you?
Okay.
Okay, good. All right. Well, so I think this is enough for our video for today. I'm sure we're not done talking about weight. At least I hope so, because I think there's more to the golden weight management rules and the biochemical reaction and metabolic chain thing that we need to look a little bit deeper in so we can understand what's going on inside our bodies. But thank you for your time again today. Thank you for your English with me. Thank you for sharing Russian with me. It's kind of like a gift that we have, that we can figure out a way to understand each other, which is super good. And for all of you who have taken the time to view this, we thank you. We're trying to get the word out from the Lymphotech Center in Perm, Russia about health and how the lymphatic system can help you be healthier. Be healthier if you're 20, 30, 40, 70, doesn't make a difference. And for those of you who are watching who do have ailments and traditional medicine or the medicine that you've been practicing hasn't helped you, we encourage you to get on the site. I encourage you to get on the site and ask some questions, because there are good medical practitioners all around the world, and there's no reason to suffer. So, Dr. Nadia, I look forward to seeing you again, hopefully in a week or two's time, where we could record another session. And for our viewers, if you have any questions, the place to write it down, I'm going to do what everybody does on Facebook, is right there, right below us, so that we can take those questions and incorporate them into some of the text and some of the study that Dr. Nadia has done that she feels is important to share with you. So, Dr. Nadia, stay cool in Russia, and I'll stay cool in Iowa.
Thank you for your attention. Thank you for your time, Daniel. Bye. See you again.
Bye.
I'm sure.
Okay. You have a great evening.
You too.